Namaste everyone. I am talking today lateral neck swelling. Lateral neck swelling lies in the lateral part of neck. If you see that these are the lateral part of neck, especially in anterior triangle and posterior triangle. These are the area of the neck. This area, if there is something swelling, you have to mention these are the lateral neck swelling. What are the common there? Lymph node everywhere in the neck. Branchial remnant you have to remember in the exam. Other is vascular or glandular structure. What are the common in the lateral neck? Branchial cyst. You have to mention. Please focus in the branchial cyst or sinus. If you come with this in exam, it's good. Lymphadenopathy may be reactive, tubercular, or other metastatic type also. Other is thyroid love swelling. Lateral part, there is also thyroid, but don't come thyroid first. You tell branchial cyst first, okay? And examiner can give the age range also. That time you have to mention as which age group is the most common swelling. Then vascular lesion, some vascular lesion, carotid body tumor, venous malformation also there, but you should tell in the, if examiner asks more, what is the more swelling like that. Cystic hygroma also come this area. Some salivary, tip of the salivary gland, especially parotid gland tumor come down there, and some neurogenic tumor. History point, you have to focus on the duration, pain, and associated symptom. Examination, yes, this is the lateral part of the neck as you see in this image. What is this? The lower border of the mandible here. This the ear. So this is the manubrium steni here. Okay. Then clavicle. Okay. What happens is this is the part sternocleidomastoid here. Swelling occur from this area, all the area of the neck. This is the anterior triangle. This is the posterior triangle. Most common, as I mentioned, you have to know branchial cyst and other lymphadenitis, tubercular, infective, or metastatic. Then cystic hygroma or the swelling you can mention, and then it's go easily. Okay, inspection wise, you have to see the anterior posterior triangle, skin, soft tissue. You also read the book, examination book from the surgery site, and palpation, soft, firm, hard, mobility. You have to look, and position of the swelling also mentioned. Cystic hygroma is positive transmission test. What are the differential diagnosis? Already I mentioned again and again because students are confusing here. Every time they are coming with a different answer. Okay, so I mentioned multiple times. First one, branchial cyst. You have to mention the branchial cyst. Know the character here. These are the next one is a tubercular lymph node. As our region is a more prevalent tubercular disease, so you have to mention metastatic lymph node. This is hard fixed lymph node. Then tell the cystic hygroma or carotid body tumor, salivary tumor, or lymphoma, whatever you like. Lymphoma is robbery. You have to mention robbery, a character of the lymphoma. Lymphoma is come in the last. Okay. Investigation again here we do the, if there is a swelling, big swelling here, first ultrasound we have to do, then what we do? FNAC. But there is a vascular lesion. That time I didn't prefer to do the FNAC. You have to do the CT or MRI. Likewise, exam you have to give the reason why you are doing the investigation. And in patient also, if you see the patient, we are seeing the patient and we have to mention why you are sending the investigation. Otherwise, now insurance is coming, insurance work here, why you are doing, there is so many blah blah question. Okay, if there is a cancer, we have to find out the primary. For primary, we have to look for the endoscopy. That is called pan endoscopy. This is some examiner can ask pan endoscopy. If you want to know the pan endoscopy, I will make the separate video or some graphic. Next is X-ray and CCT. These are for the TB or metastatic disease. Treatment wise, branchial cyst, what you do? Branchial cyst, you have to excise. Lymph node, maybe medical treatment, you give the just antibiotic. Lymphoma, here you have to give the chemoradiation. Carotid body tumor, excision. Cystic hygroma, some small cystic hygroma can be helped by the sclerotherapy, but greater disease or large, you cannot able to do the sclerotherapy. Excision is choice. Salivary tumor, salivary, especially in parotid, There is a pleomorphic adenoma common. So superficial paroidectomy and submandibular gland disease, you have to go submandibular gland excision. I think I try to cover all the possible disease in the lateral neck. I think in this video helpful to you. We'll meet you next video. Thank you. Bye.